My name is Lusine Aghajanova, and I am assistant clinical professor at the Division of Reproductive Endocrinology and Infertility at the Department of OBGYN at Stanford. So I'm a fertility specialist and I deal with patients with infertility, and the goal is to help people get pregnant safely and deliver their babies safely. We as fertility specialists are also concerned when patients are dealing with some information on the internet or from other sources that doesn't have any scientific basis. We are trying to debunk the myths and also explain patients the real situation and give the scientific background for anything we do, right? They are facts, and as specialists, as medical providers, we believe in science. We like looking into the facts and believe in facts and not in fiction. Regarding the COVID and the vaccination, we know that COVID kills and COVID is dangerous. We also know that pregnant women are particularly affected by COVID. So if a pregnant woman gets COVID, we know that the disease can be particularly severe in pregnant women, and they are at high risk for all possible complications. Another thing that we know is that so far there have been safety reports on vaccines show that they are not only effective, but are also safe for a wide range of people, age, ethnicity, sex, etc. We also know that there is no data that vaccines affect fertility. There were no specific studies that were done to study the fertility in patients that are going vaccinations. However, in all the data that have been analyzed, including animal studies, there was no loss of fertility in animals. And there was no reported loss of fertility in male or female patients or vaccine recipients in studies on vaccine, as well as on the millions of patients that so far received vaccinations, not only in the US, but also throughout the world. We know that people that were participating in the clinical trials for vaccines have been followed up, and several of them haven't gotten pregnant, and there is no evidence that their fertility has been affected. So the kind of short answer to the question if vaccines can affect my fertility, the answer is no. The mechanism of action of those vaccines don't give us any theoretical possibility for affecting fertility. There is no information and no even suggestion that those vaccines can affect menstrual cycle, hormone production, sperm function or count or whatever. We don't think they can affect placental function. There is no data that they even increase the risk of miscarriage or affect the ongoing early pregnancy. There have been really a large number of reproductive age women, healthcare workers that were vaccinated since December in this country, and I think vaccinations probably started earlier in some other countries. Every infertility clinic is recommending vaccinations for their patients, and we track the pregnancies very closely. And we do not have increased pregnancy rates in our population. The pregnancy rates in clinics across the country did not drop. So that tells us that just, the fact that you received the vaccine and people are in the country are receiving different vaccinations, different, Moderna, Pfizer, some of them received J&J vaccine. The pregnancy rates in infertile population after treatment did not drop. So I really think that these claims or myths they have no basis. We do recommend all of our patients to get vaccinated. Our general recommendation from the Society for SRM, which is American Society for Reproductive Medicine, right, supports that. Then also American College of OBGYN supports that. The Society for Maternal-Fetal Medicine, who are the high-risk pregnancy specialists, support the vaccinations for all pregnant and non-pregnant women of reproductive age. If you are able to get vaccinated before pregnancy, it's better. If you are pregnant, then this is also a good time to get vaccinated.